Hi YouTube. So I kind of just wanted to do a video about my journey. Um, in October of 2010, I went to the doctor for a regular checkup, and the doctor began to press down on my stomach, and he felt something hard, and he asked me if it hurt. And of course, I said, yeah, because you're pushing on it, it hurts. So he sends me for an ultrasound and finds out that I have a large fibroid tumor about the size of a grapefruit just sitting in there. And it's been growing who knows how long. That doctor proceeds to say the size of it will make it impossible to remove. So you should try to go and get pregnant, like right now. Literally, he said, leave here, go to get your prenatal vitamins prescription, and you and your husband need to start figuring out how to get pregnant. That threw me for a loop, big time. So we left from I left from the doctor appointment and sat in the car for a minute, and I was just just out of it. I've never had anything seriously wrong with me, or, I didn't know what this was. I didn't know I needed to do research on it. I didn't even know what that was, and, how does this affect me, and things like that. So many things running through my head. So I get home and I tell my husband about it, and he's just like, yeah, we're going to see some second, third, fourth, fifth opinions before we do this. So we left. And I think we went to go get something to eat. That next day, I went to go get the ultrasound done, and the ultrasound confirmed that the tumor was in there. So we went to a couple of different doctors. I went to 5 different doctors. They all said, I can get it out, but I'm almost guaranteeing that you're going to have a hysterectomy during this because of the size of it and its placement. The 6th doctor, which is Dr. McConnell, she was the only doctor who said, I can get it out. And the only reason why you would have to have a hysterectomy is because I had to save your life. So I was good with those odds. I was very good with those odds because everybody else just says, no, not going to be able to do it. I can't run the risk of trying to remove it. You just need to get a hysterectomy and just be done with it. And at the time, I was, 25? Yeah. So, or 26, somewhere around there. 25 going on 26. So, we decided to go ahead with the surgery, but we wanted to plan and get everything together. So, February of 2011, we opted to have the surgery, actually February the 2nd. Most of my family was able to come out because, I'm going under the knife to have things removed from my body. It was serious. It was serious, and the recovery was going to be serious. So basically the procedure I had was a C-section without a baby. They ended up doing the tumor removal, and after doing the tumor removal, I wake up, and I'm asking my nurse who's sitting right by my bed, and I can't get full sentences out, so I'm just saying words. And she said the first time I just woke up and said baby, and she says, no, go back to sleep. You didn't have a baby. So I wake up again, and I asked her tumor, and she said, yes, we got the tumor. And I went back out. The next time I woke up and I said husband, because obviously you're not understanding my broken English / one phrase, what is that game called? Charades. Obviously you're not getting me. So when I wake back up, my husband's next to my bed, and I asked him, and I said, baby. And he says, yes, baby, you'll be able to have a baby. Everything went great. So that eased my mind so much. I went back to sleep. And then once I woke up from that next nap, I was up as if nothing had ever happened. I'm sitting there talking to my family, having a good time, getting up out the bed, moving around. I'm doing the things that I'm supposed to be doing, so that in the next 4 days you'll let me go home. Well, somewhere between surgery and leaving, I contracted a very serious blood infection. When I got home that day, I wasn't feeling right. I wasn't feeling like myself, but I knew that I just had a serious procedure done, so you're not going to feel like yourself. And to top it off, it wasn't just one tumor in there. There was one the size of a grapefruit, but another one the size of a baseball sitting underneath that one. So she really worked some wonders, and she said, my body did great. My body didn't bleed much at all. It was quick, easy for her to get in and get out. So now I have a blood infection, and I'm not feeling well. My temperature's spiking. We went back all the way back to the hospital, went through ER. They said, yes, you have blood infection. They gave me some antibiotics in my IV line, and probably a couple hours later sent me home. Okay, get home. I can't keep anything down. So the next day we go to the doctor. My doctor prescribes me some antibiotics. After the antibiotics that I was taking, nothing was changing. My temperature was still 104. That next night we went back to emergency. This went on for a total of 6 days, going back and forth to the doctor, back and forth to the hospital, because my temperature is spiking and I'm throwing up now. There's so much going on in my body at this point. Just thinking about it gives me chills. But at that point, probably the 6th or 7th time going to the hospital, I said, you are not sending me home. There is something wrong. Somebody needs to figure out what this is. And probably an hour later, an infection specialist walks into my little sheeted room and says, you're being admitted now. You have a severe blood infection. And looking at your records, I don't know why you weren't admitted a long time ago, because I kept going back to the same hospital. So they admitted me, and I was in the hospital for 18 days. While in the hospital, there was a situation to where my stomach, somehow I was bleeding out in my abdomen. So they had to take a tube and stick it up my buttocks, just my cheek, like just make a cut and push it up there, to drain out the tar-looking substance that I felt like I was dying every time I had to go to the bathroom, because it hurt so bad. And throughout going back and forth to the doctor and going to the hospital, I explained that to them, and I guess nobody caught on. Well, longer story short, I ended up getting my gallbladder removed because my bile duct was infected, and they didn't know that until they removed the gallbladder. I ended up getting a PICC line to go home with, which I had in my arm for another 32 days after being in the hospital. So I had a home health care nurse. So this is super serious, outrageously crazy. That's what's happening. So everything's done. The infection is out of my body. The PICC line is removed. I'm still taking an antibiotic, but it's more of a precaution than a need. I go back to my fertility specialist, which is the doctor who did my surgery, and she tells me that both of my tubes are now blocked because of the blood infection. So I did all of that so that I would have a chance to have a child, and now you're telling me that I can't do it the way that it was meant for me to do it. So that was devastating. That was absolutely devastating. Thank God my husband wanted to go to that appointment with me, or was able to go to that appointment with me, because I don't know if I would have made it home. I was so angry. Because you had your hopes up. You had been through the worst, as it seemed. You had been through the worst. I remember coming home from the hospital and sitting on the edge of the bed, and I just bawled. That last time, once I had the PICC line, I just bawled. And my husband looks up at me and said, I know, baby, I know you've been through so much, and you have so much going on. Your emotions is crazy, but you're going to have to put on those big girl panties, and we're going to have to push through this together. This is what we're going to have to do. We're all right. We're all right. So just having that strong backbone is what got me through all of this. And still to this day. So our next option we're looking at is IVF. The way that it stands, because of the circumstances, my insurance is saying that they will pay for the procedure. However, other medications and things that are not covered under our policy, we would have to pay. So it comes out to be about $1,200, give or take, for both of us, everything that needs to be done. So that is a blessing within itself because IVF is super expensive. So now we're trying to make sure, because everything else in my body seems to be excellent. My eggs are excellent. Everything is excellent. Every time I go to the doctor, they say excellent, except for these little funky tubes. So right now we're looking at probably, this is now August. This is August now. So we were looking at toward the end of the year. So we'll see what we're going to do, and I will definitely keep you guys posted. Thank you so much for watching. I'm going to take a moment to meditate and thank God for the blessings that He has continued to bestow upon my family, upon my health, as He continues to restore this body for His purpose. So thank you guys. I'll talk to you soon.